The best inhalation method. The inhalants become effective only after entering your trachea. The expected results cannot be obtained if you operate the device incorrectly or if the overly narrow passage causes the drug to accumulate inside your mouth. This video explains the things you should keep in mind and which are common to all inhalers. Let's practice together to bring out the maximum effect. When you place an inhaler in your mouth, your tongue appears in front of the inhaler's port, blocking its path. If you breathe in without lowering your tongue, the administered drug may hit the tongue and stick there. The area inside the mouth and behind the throat is small. Therefore, the drug may not reach all the way down to the trachea and is quite inefficient. These two photographs show how the position of the tongue impacts the opening of the throat. On the left, the area behind the throat is narrow, but as seen on the right, the back of the throat is wider when the tongue is lowered. As a result, the drug can be inhaled efficiently. And now, we will briefly explain how to create the drug's intended path. Try to put your tongue out over your lower teeth and pronounce an elongated ho in a loud voice, just like Santa's ho ho ho. Lower the tongue and widen the back of your throat, creating a space in the center of your mouth. The targeted position is very similar to yawning. Let's yawn together. Did you feel your tongue lowering itself and the space created in your mouth? Now, let's replicate this position for inhaling. While keeping your tongue lowered, take a deep breath while imagining the sound of the elongated ho. If you are able to feel the air hitting the back of your throat, you are doing this correctly. If this method is difficult to understand, prepare a handheld mirror and a light, and pronounce ho into the mirror and practice until you can see your uvula. If you can see your uvula, memorize the shape of your tongue at that time. This video shows an actual person inhaling a powdered drug. You can see in the video on the right that an even higher amount of the white powder enters the trachea if you inhale while lowering your tongue. Here, a drug is administered in the form of a mist. You can see in the video on the right that an even higher amount of the white drug enters the trachea on inhalation after lowering the tongue. Let's practice with the tester that makes a whistle sound. While pronouncing the ho sound, lower your tongue, widen the back of your throat, and exhale. While keeping your tongue lowered, place the mouthpiece on your tongue and hold it. Take a deep breath and imagine the ho sound in your head. If you hear a whistle sound from the tester, and if you can feel the air hitting the back of the throat and moving in the direction of the trachea, your inhalation technique is correct. After taking a deep breath, remove the inhaler from your mouth. Close your mouth and hold your breath for about 5 seconds. Exhale slowly. If you feel that holding your breath for 5 seconds is difficult, do it at your own pace. This is the end. Point 1. As shown on the left, if there's a space between the inhaler and your tongue will not lower. Make sure to place the mouthpiece on your tongue. Point 2. When inhaling, stretch your back and neck and tilt your head back slightly as if looking up. And point the tip of the inhaler at your trachea. If the tip of the inhaler points in another direction, then the drug may accumulate inside your mouth and the medicine will not work. Point 3. If you are using a spacer, insert the mouthpiece deeply until the base so that there isn't a space between the inhaler and your tongue. And make sure that the tongue isn't in front of the mouthpiece. A natural pathway for the drug can be created by inserting the mouthpiece deeply in your mouth and placing it over your tongue. Point 4. A note on the inhalation speed. In the case of a mist inhaler, please inhale with a deep and slow breath. In the case of a dry powder inhaler, please inhale with a deep and forceful breath. And now let's watch the demonstrations. While pronouncing the ho sound, lower your tongue, widen the back of your throat, and exhale. While keeping your tongue lowered, place the mouthpiece on your tongue and hold it. Take a deep breath and imagine the ho sound in your head. When inhaling, stretch your back and neck and tilt your head back slightly, looking up. Point the tip of the inhaler at your trachea. Remove the inhaler from your mouth, close your mouth, and hold your breath at the throat. Exhale slowly. This completes the procedure. With the ho inhalation method, let's lower our tongues, widen the backs of our throats, and take a deep breath